Okay, right. So, um, obviously, you've learned on the lecture about those eight principal differentiations, and this is most of these conventional way of doing the differentiation is based on the symptoms. Therefore, we open this lecture based on the symptom differentiation diagnosis. However, the symptom differentiation diagnosis only can represent a small part of those um, the diagnosis and differentiation method in the whole practice of Chinese medicine, right? So tongue diagnosis, pulse diagnosis, as well as meridian diagnosis will help to enhance the precision and the quality of those differentiation diagnoses. Um, but because for the beginner, adding in too many of these might confuse you. So we say, okay, we're still based on the symptom because the symptom can actually provide about 50, 60% of accuracies in terms of the differential diagnosis. It's still good enough. It can give you a major direction towards the next step of for the treatment. So I think it's still good enough. So therefore, how can we start to do a proper differentiation diagnosis? This is the summary about what actually is doing. So we say the method of differentiation is basically it provides the foundation for a precise and smart start of your TCM diagnosis. So so you do need to choose different methods to be able to get the differentiation. And among all these methods, many of them are symptom associated. For example, the A principle, yin, yang, exterior, interior, cold and heat, deficiency, excess. These are mainly based on the symptom that the information you gather from the patient's presenting symptoms. Then you can, based on that, to process into a proper diagnosis. However, there are other complementary method to help you to enhance. A principle is a system of diagnosis developed mainly in Ming Dynasty. Okay, and then before that, there wasn't a name for a principle. That's more well known for like 六经, the six stages, or 胃气营血, or 三教, no, three burner, three burners or four levels. So and those ones like the Liu Jing, the six stages, mainly developed in the time when there was the cold dominant conditions in Han Dynasty. 那是张仲景 developed. That's the earliest one. And then later on, for example, in the Tang Dynasty or in the Song Dynasty, most of the conditions are diagnosed or differentiated by like organ differentiations. So 那是有脏腑辩证. So you have for like heart, liver, kidney, all that. So even leading into the Ming Dynasty, there was still a very separate and scattered information about those differentiations. So there wasn't a structured system or theory about how to develop, how to um, um, think in a logic line and help you to come to a good conclusion of differentiation with a good structure. And only in the Ming Dynasty, that was when doctors started to, sort of summarize all that, trying to bring into the external and internal, bring this organ differentiation into those eight principles. So that's how it started to be noticed and seen and then discussed and taught into the nowadays the practice, especially in the modern China, when the University of TCN start to run their own course and do the teaching. A principle was put more importance on it. So therefore, people are more aware of that. However, A principle still have its own weakness. Yeah, for example, it cannot give you, although it can, all of this, they cannot give you a very important one is cannot give you the priority. They cannot really provide what is the dominant factor, what is the prioritized factors to be treated in this stage of the conditions. Um, so therefore, there's still a lot of other things need to be uh, adjusted or worked out to be able to get the best away. Okay, so that's when like internal organs mix in with the A principle, and then tongue readings and pulse readings, especially my way of meridian differentiation, when it's coming into those positions, it stands out more. Why I should say that is because the meridian palpations differentiation is to give you the chance um, to palpate and get a number out of those pain and sensitivity of the meridians to be able to know which one stands out to the front. Usually idea is where there's a pain, there's a blockage. So therefore, where there is a sharper pain, that's a more pronounced row of pathologies standing there. So that's why I started to emphasize more on the meridian differentiation. But however, meridian differentiation can still mix in with the A principle to make it even more in a better way to work out a structured diagnosis, and also give you the guidance to find the most dominant factors or the more pronounced factors in the pathology thinking. But basically, the today's lecture will be more um, focusing on those A principle on the symptom differentiation diagnosis. So therefore, now it's the about A principle, the concept and differentiations. Yin and yang. There's the first. So in the A principle, you have four pairs of differentiation. One is yin and yang. Okay, and yin yang are not very much how can I put that way emphasized, I think, in your lectures. But in here, I might give you different viewpoints to tell you the yin yang in a good way. Because obviously in Yellow Emperor School books already they said yin yang is very important, and they say yin yang is the left and right. So this actually is how I developed my own diagnosis method. So we call the body right is yang, the body left is yin. Okay, and in January, we're going to have a tongue reading diagnosis and meridian palpation level 1. So foundations on the day, we will be talking more about this left and right and yin and yang. Just give you some ideas. You could just take it in for the time being. Okay, so body right is of yang quality, body left is of yin. So it means if symptoms start to show on the right side, it indicates something to do with the yang families. If something happened on the left, if symptom shows on your left side, it's to do with the yin problem or yin families. For example, if you have like if you have the flu, then you start to get more pronounced blockages on your left side on the nose. What does that mean? You can answer me if you want.
That
Can
means
anybody
it's
answer me?
yin.
It's to do with the yin. So mean if it's to do with what could that be? What could that be the pathology? Yin families.
It would be yin excess.
Yin excess or yin deficiency. Yes, you are correct. So yin excess means in the real case of flu symptoms, what could that be?
Maybe runny nose. Well,
Yeah, the
the yin,
pathology. the pathology. For example, if people like the flu, you block your nose and running and discharges on the nose. Yeah. So on the left of yin family, excess means damp and cold. Yeah, and with that damp and cold, then you will expect what? With the A principle, it will be clear, runny,
discharge.
watery. Yeah, because of cold and damp.
Mm.
Yeah, but if people having on the left side, and it's not clear, watery discharges, it's actually thick and yellow.
That would be heat in that case, right?
Heat, but because it's left side, that indicates the yin deficiency heat. Do you understand? Because left side to do the yin family. So left and right, yin and yang, they have a much more deeper and wider applications when you apply this principle to understand the pathology.
Could there be yin deficiency heat? Even though it's
because
heat.
yellow on thick means the heat, right? But because it's happening on the left side, it will indicate this is coming from the yin deficient heat more than the excessive heat. Okay. And upper body yang, lower body yin, that's easy to understand. Okay, so compared to the wind and cold, wind is yang, cold is yin. Or wind and damp, wind is yang and damp is yin. So therefore, the symptom will be, if it's upper body, for example, you have like a eczema, people having eczema, upper body have more issues, more rash, more itchy upper body, and the other person have more a lower body itchy, then that could indicate a different thing. Yeah, upper body will be more wind or wind heat. Lower body could be damp or could be yin deficient. Yeah. Okay. So and then pulse right and yang, pulse left yin. The same thing with the body associations. So when you touch on your left's pulse, that normally indicate the blood and yin conditions, and you touch on your right side, it's indicating more qi and yang issues. If you compare, if people coming to you to say, okay, am I a hot person or am I a cold person? And now yin deficiency and my qi deficiency, how can you tell? You just tell from the pulse you can do. By the pulse, left side weaker, it'll be gotta be blood and yin and thinner, right? If the right side thinner, means qi and yang deficiency. Yeah. And then even the person say cold and hot. Again, if it's a cold person, it will be slower. Hot person will be hot more faster, but mainly also right side stronger tend to be more yang qi and heat. Left side will be more cold and yin. The pose itself can give you the idea. And the symptom with daytime symptoms, it will be more yang. Again, if people like, for example, the flu, if people coming in with cough, right? And the cough is more noticeable and more pronounced during the daytime, that indicates that's more yang issues, which means it could still affecting the yang meridian rather than the yin meridians. Yeah, if you have more time in the evening times, especially the middle of night, waking up, that's more yin organs issues. Yeah, we use this principle to diagnose many of the condition and actually will help you to, especially when you're trying to prescribe herbs. It particularly will give you the idea which direction you need to focus on. Okay, meridian, yang meridian definitely to do with yang, external. Yin meridian to do internal. So yin yang, left and right. But you don't need to remember so many, but main thing, remember left and right. Okay. And then after yin and yang, this pair, that's the second depth. So we're trying to bring together. For example, where earlier we mentioned about meridian yang, like just yang meridians are related to the exterior conditions. Because yang meridian stays in the outside outlining of the body, they are the defense systems. So if there is a meridian affecting the yang meridian, usually that is indicated it's still external. Yeah, if the condition yin meridian being affected is internal. So exterior, interior, when it's falling into these meridian differentiations, it's much straightforward. However, when you understand a bit more from the 8 principal ways, there were other views you can see. The first thing is we actually have different concept or different understanding regarding the different levels of exterior and interior. For two types of exterior condition, one is to affect the skin and muscles, and second, to affect the channels. Yeah, so in the meridian system, you understand there were main channels, but the main channel above that, there will be we call tendons and muscular sections, and above that, that's the skin sections. Yeah, do you understand this?
Yeah.
I think for student who said already attended last times one of the meridian palpation method, they should be able to understand this better. The we say on the structure of a meridian system, there were different layers. Okay, first layer, the outmost layer is the skin sections, we call 皮部. Okay, and then second layer is the 筋, and then English name is tendinous and muscular sections. Then it go into the primary channels. That's called 经脉. And then you have other connecting into the internal organs, yin meridian going feeding up into the face to link to those they call the 经别 divergent channels. Yeah, and then that's the channel, that's the meridian, that's the 经脉 system. Then you also 络脉 system, another like a blood vessel system. That's another one to network to mix with that. But in Yellow Emperor's book, they particularly talking about when you have external conditions, it's not only talking about the channel itself. It talk about even superficially on the skin, on the muscle levels. Yeah, but then exterior conditions that includes all these depths, different depths, and then at any stops of these steps, if that is being affected, it will show up on the channel meridian points, especially on those 5 transporting points, and that's what the meridian palpation is based on. Yeah, so if you have illnesses happening on the skin sections or happening on the tendinous muscular section or channel sections, all these, they can have a connections and reflection on those transporting points, Jingwell point, river point, or Hersey point, and depends on how deep it's entering into. And then there will be showing some sharp pains or raised sensitivities to be able to work for us to work on. And yeah, so that was the exterior condition, which is slightly different than what what they call the organ association or pathology viewpoint to understand the condition. When you come falling into the meridian system, it will be more in this way. Then, because if we only talk about the 六淫, the 6 pathogenic factors, they only tell you the symptoms, but they don't tell you when these pathogenic factors attack your body, which part and which meridian it's affecting you. Then you will lose the target to work on. So that's what I said. When you only learn from those very fundamental theory about pathologies and everything, you will have difficulty to get the precision diagnosis. Do you understand what I'm trying to say? Yeah, for here, like for example, Jen said, you had dizziness when you had an attack of the flu, right? So, and then, and these can only just say, okay, we only know you had a flu, you had these symptoms, but we don't know exactly what type of these. If you presume this is wind and cold, yeah, that's fine. But how can we stop it progressing if from a precision diagnosis viewpoint, we need to find out which meridian this part is being affected. Then we can give the right formula or give the right points and needles to make the body respond immediately. Do you understand? So with the for example 6 stage. So 六经辩证, they can tell you you have dizziness. So maybe you are 少阳, which means gallbladder or triple heater meridian being affected, 少阳 symptoms. Yeah. But you also have other symptoms like running nose, headaches or body aches, all that. And that cannot be categorized into the 少阳. Then you get lost, especially for those symptoms that are not typical for a diagnosis. You don't know what else you can work on, right? But with this meridian palpation, you are able to find those meridian who where the body aches is associated, and then you can check the race sensitivities. Then you will know. Yeah. So for example, body aches. You had a body aches on the neck, or body ache on the back, or body ache on the arms and legs. So many. Then you will just check. Actually, large intestine was the most painful one. And then you have bladder meridian, the second pain ones. Then you will be able to know, okay, apart from the gallbladder, triple heater, you have large intestine meridian, you have the bladder meridian being affected. Then you can work accordingly. And then with my massage, you are able to just do massage on the point, immediately relieve the pain. Yeah, then that diagnosis is clear, and you can even, from the result of the test, you are able to work out a good formula for that too. Yeah, herbal formula. Okay, let's move on. So the as I said, we are basing our diagnosis on the symptoms. So the early on to talk about the meridian differentiation was just give you a bit more extended thinking about the positions in terms of the differential diagnosis. But based on the symptom, we are still able to allocate a certain level of diagnosis. For example, for the symptom itself, we are able to work out, okay, there's cold. Okay, that's a heat. Okay, there is some wind, there is some damp. These can be gathered easily. Yeah. And then at least external condition, it's the characteristics of the external condition is acute, usually seeing the first stage of disease on surface of body, like skin disease. chills, usually due to exposure to one of the six evils, even often affect head, and shoulders because the wind. So it brings everything up and then causing the upper body to start with. So, and normally the first sign are like sudden onset, acute disease, fever chills, cold, and flu with aversion to heat or cold. Yeah. And then sometimes you can combine tongue or pulse reading to be able to be more information and then confirmation on that. And then common conditions related to this are like cold, flu symptoms, fevers, headaches, respiratory congestions, eruptive skin diseases. So like skin rash, like hives or eczema, or even psoriasis on an early stage. They could be all part as the exterior conditions. So for this part of that, usually we will suggest, apart from those 8 principles, we suggest 6 stages, the 六经辩证, or 4 levels, the 卫气营血辩证, are the one to help you to get a more precise diagnosis. And then which one to work to which is to set the symptoms. 六经 is related to the cold symptoms, and 卫气营血 is to do with the wind heat symptoms. Then how do you know is cold symptoms or is the heat symptoms? Can anybody answer me? How do you know what it is? Without knowing this, you won't be able to choose whether you should go to the 六经 or the 卫气营血. Anybody can tell me?
Sorry, I didn't get a good question.
The question is, all right, so you have people who you think this is external, because the external condition means, symptom people like coming all of a sudden onset, like the flu symptoms. You have headaches, you have running nose, and you have body aches. You even feel dizzy, nausea. Okay, all the symptoms starting, and in terms of the diagnose, you have to go through these either choose a 6-stage 六经 or 4 levels 卫气营血. This is a starting point. You have to choose the right differentiation method to be able to get the proper diagnosis.
So your question is what to choose?
What to choose? What made you choose whether you choose the 6 stages or the 4 levels?
I guess it depends on the symptom they present.
Yeah, so I already in the red writing already here, right? So follow 6 stages: wind cold oriented and wind heat oriented. But how do you know it's wind cold oriented or wind heat oriented?
It's their symptom. Wind cold tended to aversion of cold.
Aversion to cold, right? Yes. And wind heat, aversion to heat.
Yeah.
Okay. But this is sometimes very subtle. But you more or less get the core of that, right? For me, to be able to get the right one, right? And first, simple and easy, is to look at the season. In this season,
Cold.
that's no heat. Okay, so in the winter, when the colder season, that's cold, right? In the summer season, hot weather, that might be heat. So that's a simple, easy. But for sun condition, for example, in many of these hot country or region areas, people are not like hit by the wind heat. They get heat, but then they come into very cold air-conditioned rooms. They get cold. So for that case, you still need to look into the symptoms. I just say if they are coming from the cause of that. So you're looking at ask questions and the histories of their illnesses. What actually initiate that? Yeah, you know what we call it 空调病, outcome diseases. Yeah, so this actually is cold. And then from my viewpoint also, that's another method very easily to help you to find whether this is cold or hot is one, checking the tongue coating. The coating itself, if it's white, it's cold oriented. Yeah, if it's dry and yellow, really dry and yellow, that's heat associated. Yeah, once you see dry and yellow, then you can look into those 4 levels. That will still help you to go through. But if you, as long as the coating is moist and white, cold associated, go to the 6 stages. But when it comes to the meridian palpation, it's even simpler. How to do? You just check which side of a meridian is painful more. Left side more painful, cold associated. Right side more painful, heat associated. And then you're able to work out whether you need to use the 6 stages or 4 levels. Okay, so any question up to this level, this point?
No, I just wonder, are you going to teach us the 6 stages and 4 levels? So far, I don't think we had that
I think
lesson.
I think the 6 levels and 4 stages so 6 stages and 4 levels are taught by Dr. Shi.
Okay, we need to go back to
In
have a
his
look.
lecture, you go look at his lecture, Dr.
Okay.
Shi's.
Okay, I'll go back have a look. Thank you.
Yeah. Right. So what about interior condition? Because we'll talk about external now. The interior condition. So that means when the disease is whether it's coming from outside from the exterior, and then when they enter into the organ level, then it becomes interior, or it's created from the inside, and that hits directly the interior condition, the organs, and that is still called interior. So, for example, a condition like diarrhea, right? So you can get from the food poisoning or from the stomach bug, then causing diarrhea. This diarrhea is interior or exterior. Anybody can tell me?
What do you mean, sorry? If it's interior, it's usually related to spleen, isn't it? When the spleen chi goes down.
Or liver invasion, or
Yeah.
kidney deficiency. There can be all that, yeah? So, but for a person who had diarrhea from food poisoning or from the stomach bug, this is coming from outside. So this is still called exterior. But when it's go for too long, a long time, like several years later, then it started to cause more diarrhea whenever he had not good condition like cold food or raw food, and they start to have diarrhea. This is already enter internal because that shows some spleen chi deficiency. Then this is called interior. Okay, for that is actually just showing exterior and interior. They don't necessarily to be completely separate. Yeah, there might be the progression of one certain condition. But as long as you can see there is a internal organ, particularly these yin organs being affected, then you can call it interior.
So just to check that I understand. So you're saying a condition can be considered exterior, but if it enters the internal organs, it will automatically become an interior condition. Is that what you are saying?
Yeah. Well, this is the idea, the understanding of these different levels, right? First level is we can understand a condition coming from the exterior can be called an exterior condition, but when it's developed into interior, like it started to harm diarrhea, harm the spleen, then you can call it interior. However, at that stage, they are not still separated. That means you could call interior condition with exterior symptoms. Okay, the first level is, yes, that is interior. But second level understanding is there is interior, but at the same time, exterior didn't disappear. Yeah, they are not completely separate. That means exterior condition, when they are still in exterior, they still call exterior. They are not completely, when they come into interior, there might be still some exterior there. So the point what I'm raising here is you can see some of the case studies, right? If you do have a case in your exam, there might be a case like this, right? You can see a lady who had problems with diarrhea or vomiting or stomachache because they had a bad food on holidays. And then after 5 or 6 years or even 10 years, she had a very sensitive stomach problem. And then would you diagnose as what? Is that exterior or interior? And
Interior.
how can you identify whether this is exterior or interior?
I think it's interior after 5 years now.
When a condition when it's developed chronically, yes, there could be some interior conditions. Yeah, I say there could be, but that means there might be still some exterior. If the root cause hasn't been sorted, and it could be still there. Okay, so and then for this case, my diagnosis will be we'll need to see which one play a major part. Means if there is exterior conditions, then those exterior meridian will be raised sensitive. Right? The sensitivity on the young meridian, say for example, stomachache. Yeah, and then you'll find the stomach meridian still highly sensitive. That means exterior is still there. Yeah. And if the stomach doesn't really show much of those sensitivities, and then you do the testing on the stomach meridian, it doesn't really work until you start to work on the spleen. And the spleen meridian works better, then this is called a pure interior. And then in many cases, you work partially on the stomach meridian, it works, but not fully until you work on the spleen and it works better. So then you call a mixture of interior and exterior. Okay. So that's what we're trying to conclude here is symptom-wise, yes, you are able to figure out whether there is 6 evils, pathogenic factors affecting it, but to be able to get exterior and interior fully understood and clearly differentiated, it will be better for you to get a bit more deeper, in-depth understanding, which is not now for me by the meridian palpations. Meridian palpation could be able to get you, okay, if there is an exterior, young meridian will be showing some red lights. If it's to the yin meridian, the interior conditions will be put into that. Okay, so up to this point, do you understand? Do you have any questions?
Just one question, Dr. Ye. So do you, I mean, if you're not sure in this case, according to this slide, so you palpate literally every meridian just to determine if it's yin or yang in that case.
That's right, yes. Well, I don't necessarily to palpate all meridians. I'll palpate the associated meridians. Usually it's related to if there is meridian structures, either the primary channels or the skin or the tendons, muscular sections go passing those area where the symptom is presented. Okay, so do you understand? So for example, we had a forehead headache, and then center in the middle, and then apart from the, we normally say forehead is to do yang ming, right? So stomach and large intestine, but you understand that bladder meridian, gallbladder, they're all coming around here. So we check not only the large intestine and the stomach meridian, we also checking the bladder and gallbladder. And after that, we are able to find, oh, which one meridian actually has a higher and more sensitive point, which then that might indicate this is the one that's affected the most. Then we can allocate that.
Do you check around head for that meridian, or do you check any other parts of the body to determine?
We check on the end of extremities. We have the specific point for each meridian, so diagnostic point.
Okay, thank you.
Yeah. Right, so that was about exterior, interior, and summarize is go to the yang meridian and yin meridian. So they will give you the ideas. Yeah, the symptoms are, yes, they are good, but they are not good enough to be able to give you the right and precise information for a proper differentiation diagnosis. And cold and heat, and especially they need to be mixed with exterior and interior. As I mentioned early on, when you have the symptoms showing, you know this is exterior, but you have to really identify whether it is cold and heat to be able to use or utilize the proper method for diagnosis, 6 stages or 4 levels. Yeah, so that's the cold and heat mixed with or combined with the exterior and interior. Symptom-wise, there are so many. Oh, so you can see all this sudden onset as an external, and body aches and sore throat and all that. And the heat, internal cold, more slow onset, gradual, no fever, dull aches and all that. Are they important? Yes, they are important. Those symptoms you can list more than I listed here, right? But you don't have to remember or memorize all of them. You don't have to memorize all of them because obviously it's a lot more to do. But internal and external, when it comes into the cold and hot, again, if it's coming into the meridian palpation, it's much more straightforward. Cold means on the left side, more painful. Heat on the right side, more painful. I'll talk about sensitivities on meridians. And external, yang meridians. Internal, yin meridians. If it's put into that, so it's say external cold, there will be yang meridians on the left, more painful in sensitivities, right? Internal cold, that means yin meridian on the left, more painful. And then just remember the cold symptoms. Anything to do with cold, you can for you to understand or to learn the TCN foundation. You know, there's aversion to cold or feeling cold, cold hand and feet, and all that. They can be all put in, fit into all these little spaces. So that's what I said. If you want to differentiate meridians, it's much more straightforward. So example, external cold, symptom, like the symptom mentioned here, okay, plus increase the pain on left yang meridians. For example, on the left bladder 60 is painful, then we can call cold invading bladder meridians. So if you had the flu nowadays on your headache, particularly on the left side, feel more painful in the forehead here. And then you check on the bladder meridian, bladder 60 on the left side, and raise the sensitivity. You know, okay, this headache, although it's like called Yangming headache, is actually caused by the bladder cold. It's not a purely a Yangming, it's a called Taiyang headaches. So only from the symptom itself, it can only give not 100%. Many of these 60 maximum accuracies. So instead of using like large intestine, because we know large intestine 4 is for anything to do with head and face, right? You're working on the large intestine 4, it's not as effective as bladder 60, especially on the left side. Do you understand what I'm saying? Yeah, so if you do have anything difficulty catching up with what I'm saying, just raise your hand or just ask question, open your mouth. Otherwise, I presume everyone understand. I'll just move on. Right, so that is the external code, and internal code normally is the symptom. Looking at this chapter, the chart on page 12, and then more precisely is you look at increased pain on left yin meridians. For example, left side, left to do with yin, right? Cold, liver 8 pain. So that could be damp and cold invading liver meridians. This happens for people who could be like you have discharges, period pains, and watery discharges, and very cold, and didn't like the cold, period pains, and preference to warmth and heat when period pain happens. Then you can check that is to do with the cold invading in the liver. So here's the heat, the symptoms, external heat, right? So exterior means there's all of a sudden and all that. And the internal heat much more stronger. So with the symptoms, still sometimes have difficulty, then you look at the meridians. So external heat, usually symptoms, plus increased pain on right yang meridians. For example, you have large intestine 11 on the right, more painful, and the heat invading large intestine meridian. This happened like for people, for example, when you started to have a fever, you had like sore throat, especially like in the winter time, summertime is like a cold symptom or flu, and the people had a very sore throat. And then you check, oh, large intestine 11, very painful. Then you can do this and clockwise massage on that point that can release the pain. Then you know, okay, this is the wind heat or heat invading in large intestine meridian. But if it's the internal heat, that will be the symptom, plus increase the pain on the right yin meridians. Say, for example, right side liver 2, very painful. Yeah, we say liver 2 is the one for liver fire. So actually, this shows the liver fire. So with that, you can have very loud and aggressive tinnitus in one side, like that, like oh, that type of noises. This type of an tinnitus usually indicating some fire and heat. And then you could easily find liver 2 is painful, or liver 3 or liver 2 is painful. Then you can diagnose it as liver fire. So cold and heat symptoms, good for you to understand. But if you combine with meridians, especially combined with the exterior and interior, it will be able to really precisely diagnose and works much better and efficiently. And excess and deficiency will be the next one. And then particularly
Sorry, Dr. Yeah, I have the question. Regarding for the exterior and interior code, I have the example. For example, if the patient is one for the sore throat, but with the clearly mucus and the runny nose, and with the white coating or light coating of the tongue. And
so I will still say this is the cold oriented.
But with the fever, but the cold with the tongue, the white coating, and also pink tongue. So how do you define for this? They have to have.
Well, with the cold symptom, you can still have fever. So fever is not a strong sign for heat or cold differentiation. Cold,
but the serious sore throat or red.
sore throat can be a sign of heat. That means something turning to heat.
Something turning to heat. So it's cold.
You could have. So that's the thing with those symptoms differentiation. A principle, it will not give you those complicated conditions. They can only give you very superficial ideas. Only by meridian palpation they can give you more in-depth and clear logic thinking about these pathologies. It could be to do with cold invading still in the bladder meridian because you have running nose, clear discharges. But then there can be like insufficient heat accumulated in the large intestine meridians.
Will you give the cold formula medicine or hot medicine?
So you could, you can have a combination. Cold dispersing for bladder meridian, but heat clearing for large intestine meridians.
Oh, so mix it together for the formula.
Mix together.
Okay,
yes.
I see. Okay.
Yeah. So so this is the complication in practice. Many of the conditions depend on people's constitution. Then they can have different things. For example, we could have pretty much similar. Like people have a lot of lung yin deficient of lung heat, but at the same time you can have the cold outside. So internally, you have running nose, but then a clear running white nose or phlegm. But the next morning when they wake up, they can be yellow and thick sputums. Yeah, so that's the thing. So outside layer of ice and cold, but internally there can be still insufficient heat.
But for this, will we treat the heat or cold, no matter how which way for the acupuncture?
You can
Both,
treat because
both.
both. Externally, you work on large intestine or bladder for the cold, but internally you work on the lung for the heat or insufficiency.
Okay. Yep.
Thank
you.
Thank you. Right. Okay. Let's move on. So excess and deficiency is also need to be looked into, especially when it's in the combination of so many different things like excess colds or deficient colds or excess heat, deficient heat. Right. So here, excessive cold, more acute, deficient cold or chronic. And the difference will be excess cold means it's cold dominated. Deficient cold is yang deficiency dominated. So when there's deficiency, so that's the mild. So the symptom, the level, severity will be milder than the excess. However, when it comes to those differentiation by meridian palpation, again, it's much more straightforward. For example, you have the excessive cold. It will be symptoms plus increased pain on the left meridians. Clockwise, reducing method effective. So the symptom can be, sometimes they're not like very clearly distinct. There might be, you're not sure whether it is deficient or excess. How can you identify these? Then you can just use another method in diagnosis with meridian palpation. Just do the clockwise or anti-clockwise. Right, we use a clockwise massage on the point to reduce. So if this working, that means excess. Reducing, working, indicate that is excess, so the needs reducing. So if it's using a tonic anti-clog massage to be able to get symptom better, then this is deficiency. So that's as simple as this. So easy example is, for example, we found left liver aids painful, and you reducing on that left liver aid, and then symptom better. Like for example, earlier on we talk about if the patient has a period pain, right? And if you do find the pain on the liver aid is very high. So on the liver aid high, that could be indicating two things. One, excess. One, deficiency. Excess means left side means cold and damp, or blood stasis. And if it's the deficiency, will be yin deficiency, liver yin. So with this method, you're not sure if this period pain is caused by blood stasis, damp or cold associated, or by blood deficiency or yin deficiency. How can you like differentiate it? And my method is easy. Just apply clockwise massage on liver 8 or anti-clock massage on liver 8 and compare which method make the period pain better. Right? Clockwise means reducing make it better means excess. So that means this is caused by blood stasis or cold invasion in the liver. Or if anti-clockwise massage make the period pain better, that means, okay, this is to do with blood deficiency. So that is deficient cold. So excess and deficient heat, the same thing. Excess heat means a very strong coming from outside, very strong excess. And deficient fire indicate not a fire, indicating the yin deficiency. And one thing to mention about is particular those feeling of heat or thirst or dry mouth. That's interesting to mention here. The heat, if to do with excess heat, usually because there's a really strong yang signs, it's daytime, the heat, and the thirst also in the daytime. And if to do with deficient heat, it's usually in the evening because evening is to do with the yin. So you have like you have hot flushes more at nighttime, thirsty more at nighttime. That's yin deficiency heat. And if you have a fever coming from like cold and flu, usually people when they're awake, during the daytime, they feel fever. Then when it becomes like more hot or feverish at nighttime, middle of night, that usually means yin deficiency. Have you had any experience like people coming to you and telling you they feel thirsty at night, or middle of night feel very, or waking up in the morning feel very thirsty, drink a lot of water?
Maybe menopausal woman.
Menopausal women, yes, they do have that. That is a very typical yin deficiency. Yeah. However, one more thing to mention, feeling thirsty or waking up feeling thirsty doesn't necessarily always 100% related to the yin deficiency. Remember, we said damp cold or damp can be also a yin nature. So people with damp can also, or fluid, can also having waking up or middle of night thirsty. So how to identify this? How to differentiate whether this is yin deficiency or whether this is damp associated thirst? So, well, before I answer this question, Bilge, you raise your hand.
No, I was just going to check because you were asking earlier on. Would that be if in the middle of the night, if you're feeling thirsty or you're, feeling heat, would that be empty heat rather
Yes,
than?
yes, it is the empty heat. But as I said, because this is to do with, because the nighttime is to do yin, daytime to do yang, right? So nighttime also can be like damp, fluid, or phlegm, or even blood stasis. That could be all yin excess. So a mixture, but most common one is the yin deficient, yin deficient heat, like causing those damp, the thirst. The different will be yin deficiency associated. They like to drink colder water, and normally a sip of water is able to soothe the dryness and the thirst and the heat. They don't need a lot, a little bit, they'll be fine. If this thirst or dry mouth is caused by fluid or blood stasis, they don't like cold water. Sometimes slightly warm water works better for them, but small amount. Once they drink too much, the more they drink, the more they're thirsty.
Yeah, can you say again? Sorry, I mixed up this one.
With the damp and fluid or blood stasis, they hate water. They don't like water because the more they drink, the thirstier they feel, especially with the cold water. So for this time, normally, even people complain to me in practice, they say, I feel thirsty at night. I feel thirsty, I feel dry mouth when I wake up in the morning. I will ask them first to test out. Have a glass of water. One is cold, one is hot. Ask them which one they like better. Okay, usually in deficiency, they feel cooler water can help to soothe them better. And the fluid and damp, no. They might feel better with the warm water, or they hate both either, hot or cold. Okay, let's look. So differentiation, excess or deficient heat. So excessive heat will be symptom plus increase the pain on right meridian. Clockwise reducing method, effective. Like for example, earlier on we said liver fire. So people have like a tinnitus, right? And you find liver 2 on the right is very painful, and you apply the clockwise massage and it works. It can reduce the tinnitus. Then that's definitely liver fire. Okay. And if it's deficient heat symptoms, increase the pain on the left or plus right meridian. Because if it's the heat, right side can be also painful too. Yeah. But usually the point shows an hollowness. And then actually when you do the left side on the and the anti-clock on the left side works better than the right side. But obviously, if it to do with the yin, what's the deficient heat usually means yin deficient, leading to heat, right? So usually symptoms it's not on the right side. Usually symptom is on the left side. For this one, tinnitus deficient heat will be more on the left ear. Okay, so a principle actually apply in the yin yang, the external, internal, the cold and heat, and excess and deficiency. Although if you look into them separately in different pairs, it still doesn't really make any sort of a good sense until they really can mix in with combination and mixing with organ differentiations. Yeah, but then the whole thinking logic becomes too complicated because there are too many lines, joining together, and it still sounds too complicated. So how do we do? We're trying to work out a method. So the procedure of symptom differentiation is working this way. Step one, when you have a symptom presented to you or a patient coming to you for a consultation, step one is to ask questions to identify whether this is exterior and interior. Yeah, so the exterior means on set, and all of a sudden, for me, very important question is if you want to identify the exterior from the interior, one of the most important and most common question I will ask for patient is, can you tell me what causes it? What trigger the symptoms? What trigger the occurrence of this associated condition? It's because this is the nature of illnesses. Anything coming with like wind or external that penetrated our body, usually without a very strong cause or presentation of symptoms. Either people easy to find out, okay, this symptom coming from a cold and flu, but many of the conditions are not caused by a typical symptoms of sufferings in the beginning. And if you do have cases like this, it's usually exterior condition. Okay, so typical sign, I'll tell you two cases on my case. One is I think it's a 60-year-old lady who all of a sudden developed into what they call I don't know what's the name of the English name now. Something disorder, sleeping disorder, and this lady can fall asleep within a second, even like sitting on the dinner table. No reason. All of a sudden, one day she started to get very sleepy, and then even one occasion she was like looking after her grandchild. She was cuddling grandchild, very baby grandchild, trying to feed the grandchild the milk, and then all of a sudden she falls asleep, and then nearly fall. The baby drop out of her hand. And then in many of the conditions, sometimes she throw the bowls at the dinner tables and just fall asleep. And I was trying to work out what causes, ask her questions about what happened, and obviously that all this all been investigated by the Western doctors and Chinese doctors locally. None of them can find out what's going on, and obviously there's no solution to it. All right, if you were me, how can you identify these conditions? How can you treat this? Bilgi, yes.
Your meridian palpation method.
Yeah, well, my idea will be coming from the same as I mentioned. Okay, this condition coming from nowhere. In Yellow Emperor's book, we call 驱邪贼风. We call all those 风为百病之长. All right, so Chinese in Yellow Emperor's book they say wind is the big brother of hundreds illnesses. That's the literary translation. Right, that means condition can secretly coming into your body through the penetration ability of the wind. Right, easy to understand if you have clothes, right? Like for example, you have a knitted cardigans, right? From the inside, you have just the cottons and not really tight like airtight or like a heat tech, that type of clothes, but just like cardigans. But the other person who have a more so tightly knitted and made clothes. When you come into the cold weather, you possibly wouldn't really tell the difference because it's a quiet, there's no wind weather. Even it's cold, like 2 degrees outside, you possibly will stay fine with the cardigans, so woolly cardigans. However, when there is a strong wind, even with the same temperature, the person who had a heat tech clothes, thermals, or the person with the cardigans will feel the difference. Which one will feel colder? It's the one who has the cardigans. Why? It's because the wind has much more penetrating ability, can through very small slots and small spaces of clothes and fibers and enter your body and get touch in and make you feel the cold. The same thing happened to in the real body, in the real case, right? So with the wind itself can bring anything easily into your body and without you being aware of it. So that's why we call it 贼风. 贼 means the theft. 风 with the wind means wind. The stealing wind is the one that bringing everything into your body. So that's why we call wind is the big brother of all 100 illnesses. 风为百病之长. So that means any symptom showing up without an obvious and apparent, incident or apparent appearance in the beginning, that could be a sign of exterior, layer of your body being attacked. Then it develop a symptoms, any symptoms. So this is one of them. It's like what I call spontaneous sleeping disorders. That's one case. In the end, meridian palpation found out, meridian, obviously the young meridian, son of the meridian. So I'll give her some formula which is using the same ideas for cold and wind attack, like flu. And that sorted her condition out. And that's another one. I didn't even use any herbs. I just give the meridian palpation and meridian massage. This is a lady. The family started to worry about her because she all of a sudden, this is a 70 years old lady. All of a sudden, she starts to have a panic attack, and then so like a big restlessness, certain time of day. When it comes to like 6 o'clock and 7 o'clock time, started to get very restless. And then she was giving all those medicines, tranquilizers, none of them seemed to help her. And then in the end, family thinking maybe she need to send to the mental hospital. When she at one point, she was even sent into those wards was like a locked ward in hospitals, really serious mental illnesses. So she screamed and refused to go into that ward. In the end, and then she was referred to me because obviously family know about me and then asking if you can do something about it. So I gave her those meridian point to check. I found out actually that was to do with gallbladder and Sanjiao meridian. Again, that's the young meridians. And her histories, yes, no, there's no mental trigger, there's no incident that can bring this on. All of a sudden, at one day, she started to notice that the symptoms, and it becomes worse and worse. Working on the external. So, very much important question about any condition when you start it, it's what started off this? And if they don't, think about exterior. That's my advice. Okay. So step 1, identify the exterior from the interior. Step 2, then if that is exterior, then you go to these to the cold and heat oriented questions. Right? Ask questions, check the tongue coating. Okay, then I will be able to guide you through the exterior conditions, either using 6 stages or 4 levels. And then once you identify that is some interior condition, then go into the interior. The interior will lead you to those internal organ differentiations. And then under that organ differentiation, then you will further develop into those 4 substances that belong to the organs: qi, blood, yin and yang. And under this category, qi, blood, and yang, then you have excess and deficiency, excess and deficiency. So qi excess, qi deficiency. Qi excess means qi stagnation. Qi deficiency means qi deficiency. Yeah. The same thing with blood excess, blood stasis, blood deficiency, blood deficiency. Yin and yang, the same principles apply. Once you come to that level of differentiation, you nearly come to the final conclusion of your the treatment and consultations. But to be able to get more precise differentiation diagnosis, then you can add in the meridian palpations. Meridian palpation can get you even more like in-depth reading about the condition. And tongue reading and pulse reading, complementary. You don't have to learn at the moment. Okay, so exterior-interior differentiation was the one we say first. So the symptoms can give you the ideas, whether it coming the wind or some heat or fire or dryness or dampness or cold and food retentions. These are, you can get it out from the history questionings with the patient. But interior condition, then you will come into the qi, blood, yin yang, excess deficiency, all that. And then this is all can be also linked to the different organs, like liver, the 5 organs, 5 yin organs, or including 6, plus the pericardium as an attachment to the heart. So that's the the different depths when you come in, a symptom coming, then first of all, see whether this is exterior or interior. And then exterior, tell from those cold, from the heat, and then go down to six stages and 4 levels. Interior, then you further develop into the 5 organs. And then 5 organs, qi, blood, yin, yang, excess and deficiency further develop. That's how we work out in the structure of differentiation line. Then internal organ differentiation. Under this, we'll just give you some summaries of each of those organs. So, for example, we know the functions of lung. The first one is the lung. So we call the minister the qi controller. It governs the qi and respiration. So these are the symptoms in red. So breathing, cough, sighing, chest, and voice. These are the key words related to the lungs functions. It controls the channels and blood vessels to do with gathering qi, zhongqi, and nutritive qi, circulation, cold limbs, and meridian channel disorders. And then lungs also controls descending and dispersing. This relates to defensive qi, the keyword. So dryness and water metabolisms and urines can be also related to, because descending, going downwards. And lung also regulates water passage. It's the upper source of water passage. So therefore, the keyword is water retention of phlegm, yin, fluids. Lung dominates skin and hair. So therefore, anything to do with the skin and hair, the body hair, not the scalp hair, rash and irritation of skin, dryness skin, and body hair problems. And lung opens into nose, anything to do with smelling, blockages, or running nose. And lung houses the corporal soul, the poor, the sadness and grief can be also affected. So the key words of that, like breathing, and like the defensive qi, and the phlegm, and skin, and nose, and emotion of sadness and grief are the keywords. So you could if you able to, this is also quite important if you come to those short questions in the exams. So this just give you a little review on those, the knowledge point of that. So for me, how to identify this is to do with lungs, condition or pathology. The key symptom, most common one are these two, breathing and voice. And these are the most common patterns. Like for example, lung qi. So you have deficiency and excess, qi stagnation, excess. Okay, and you have lung yin deficiency. And then lung cold and phlegm stagnation is the yin excess. And lung fire is the yang excess. Then you don't normally have lung blood issues. And you don't normally have lung yang deficiency, very rare. So next is the spleen, the controller of transport and transformation. So spleen governs the transformation and transportation. So it doesn't transform, so it doesn't produce enough blood and qi. So it leads to tiredness and weakness. And then it doesn't move the transportation properly. So it causing water retentions. So then it causes puffy tongues. Overall puffiness. And spleen has also a function of holding everything, particularly one holding the blood within the blood vessels, therefore bleeding. Usually it's type of like leaking or a prolonged like bleeding process. So leaking, so normally a leaking of bleeding. Spleen dominates the muscles and four limbs. So therefore, weak or wobble limbs and muscles atrophies. Limpy, flexy. This is all sign of like muscle losing the strength and ability, often indicating the spleen's condition. And spleen also has a good lifting effect. So in lifting the goodness, qi and blood into the brain. So memories, thinking, concentration abilities, focusing abilities, even the eyes focusing, ears focusing to hearings, that can be all to do with the spleen's lifting effects. So therefore, symptoms associated with that is brain fog, muzzy head, blurring visions, hearing, headaches on top of the body, anything to do with that. That could be indications of spleen. And spleen opens in the mouth, so therefore anything to do with the mouth and tongue, including the saliva gland, and including the mucous membrane in the mouth and the gum. And spleen manifests in the lips. Lips is usually around the lips, around, not the lips color, because the lips color actually is the heart, the corner, white bit around the lips. And spleen houses the the thought, intellect. So concentration and studying capacities, ability to putting things into actions, dedication to, doing things and making things happen to do with spleen. With a weak spleen, normally we'll call those people are called Mr. or Mrs. Tomorrow. Everything put tomorrow, tomorrow, tomorrow. That normally is a spleen deficiency. A pattern of spleen pathology, typical of keywords is tiredness, digestion, and puffy tongue. So 3 keywords, remember, generally feel tired. And then anything to do with digestion, like eating, appetite, bloating, acid reflux, or even bowel movement. Anything changing can be a sign of spleen. And then these are the patterns: spleen qi, spleen qi stagnation deficiency, spleen yin deficiency, very rare. Spleen cold and damp, that's the yin axis, that's common. Spleen fire, not very common, usually stomach fire. And spleen yang deficiency, yes, that's all. Yeah, and spleen blood is usually is not a particular dedicated to the spleen. Spleen weak will cause the overall general blood deficiency, but not particularly related to the spleen itself. And function of kidney. We call kidney the official of power creation, controller of fluids. Okay, and kidney store genes. So dominates birth, growth, reproduction, and development. Right. So sexual functions, fertility, body development, puberty, that could be all related to the reflection of the abundance of kidney's energy. Kidney produces the marrow, so fills the brain and spinal cord, dominates bones, and manufactures blood. So therefore, if the weakness of the kidney, it could cause weakness of thinking abilities, and generally feel the emptiness in the head. It could be like dull, mild but persistent and chronic headaches, and dementia, bones problems. MS, when it's developed in the brain, developed in the nerves, because we say because of the brain itself is the ocean of bone marrow, the marrows. So that's why to do with nerve. So central nerves, more or less indicating that certain involvement of kidneys because of those marrow involvement. And kidney dominates water, so urination related, water retention related, especially the second half of the body, means from the waist down. If there's anything particularly from both sides, you have swellings, you have issues with water, and then that could be an indicator of the kidney or the spleen as well. Yeah, spleen also, because spleen is the middle jiao. And liver controls the reception of qi, so inhalation. Yeah, so lung is in charge of the respiration, so exhalation is related to lung, but inhalation is related to kidney. It's anchoring the qi. Kidney opens into the ear, so hearing, tinnitus, troubles with the ears can be related to the liver, to the kidneys. However, because the liver meridian, gallbladder, senjao, and many other meridians go around the ears, that can also cause issues with the ear. So not all ear problems is to do with the kidney. But however, kidney opens to that. If there is an issue with the kidney, usually affects both sides of the ear. And kidney manifests in the hair. So particularly when there is a kidney essence deficiency or kidney deficiency, the first thing with that is either the graying of the hair go graying much earlier age. That's the main thing. Then, if particularly related to the kidney yin deficiency, hair loss, dry and falling. And kidney controls the two lower orifices, means urine and bowel movement, both ends. Urethra, vagina, rectum, and anus, urine and bowel. House is the wheel. Okay, so and it's to do with the determination, to do with the willpower, and kidney also play a part. The patterns of kidneys pathology generally we'll call general weakness. So compared to the spleen qi deficiency, kidney is the root of the overall life force. We call prenatal life force of kidney. So therefore, if there's involvement of kidneys deficiency and then affecting your constitution, generally is weaker, even weaker than the spleen. Yeah, but to talk about particular allocating symptoms related to the different patterns of the kidney, I would say these two, night urine and night sweat. These are two particular distinct symptoms associated with the kidney. So night urine related kidney qi and kidney yang deficiency. More than one time a night. So as a healthy body, you're not supposed to get up even once during the night to pass water. If you do get more than once, right, that indicating certain level of problems, often kidney qi deficiency. So people will ask, oh, I go to like a half an hour in the daytime, go to toilet. Am I having weak kidney? What would you say?
Yes.
Somebody said yes. So for me, no, because
Oh,
if it's to do with a kidney deficiency, I will ask, do you get up at night to pass water? If they don't get up at night, they only get up in the daytime, even very frequent, like half an hour going to. It's not a sign of kidney. It's a sign of bladder. Hi, Bilgi.
If that's the case, let's say it's a person wakes up several times at night. So we will do tonifying, right, in the kidney meridian, or if I'm not herbalist as an acupuncture, would you be just working on the kidney points just to tonify and increase the kidney efficiency? In this case, yang deficiency.
Yeah, I will definitely suggest that if without like a investigation further, I will suggest that if they don't do acupuncture, ask them to do kidney 3 anti-clock on both sides of the foot. Before they go to bed, like 100 to 200 circles, anti-clock on both sides, gentle massage on that point for 3 nights, up to a week. If they work, that means definitely kidney.
Okay.
And I would say 60 to 70% it works for them.
So, sorry, which acupuncture point?
Liver 3.
Liver 3.
Did you say liver 3 or
Taixi.
kidney 3?
Liver 3.
Okay, so liver 3.
Oh, no, sorry, no,
Kidney 3.
no, not liver, kidney 3. Yeah.
Okay, kidney 3
Yeah, kidney 3.
anti-clockwise, and then if it's acupuncture, it's kidney 3 as well, right?
Yes, yeah.
Thank you.
Okay, so these are, and so urine, but urine at nighttime is the key. It's the really characteristic symptoms you need to remember for kidney diagnosis. And then for kidney yin deficiency, night sweats definitely, for sure. Yeah, and people say, oh, we know night sweat, and I know the hot flushes. There might be, but we do also have people who doesn't really show those typical symptoms. What else you can do? You can help them, and more common ones than night sweats. The other symptoms.
So what was the question?
The question is, night sweat definitely is a strong evidence to diagnose for kidney yin deficiency. But there are some variation of symptoms.
Would this be related to menopause mainly, but it's empty cold or something?
Yes, but so as I say, some of the people who not necessarily showing that night sweat all the time. Yeah, but we see on young ladies, one is a typical before periods, feel hotter or difficulty falling asleep, difficulty sleeping before period comes. That's a typical sign kidney yin deficiency. And the rest of the months they're fine. Feel hotter before period. Yeah, or a typical one, especially for kids, is they wake up, their feet sticking out of duvets. They don't necessarily feel sweaty, but feet sticking out of duvet or cover. So you can ask questions. do you have night sweats? No. And then don't stop there. You can further ask questions. For ladies, you can ask, do you have issues feeling hot before period comes? Like a week or several days leading to period cycles? Or do you have issues sticking your feet out of your bed? And then for heat, very often, if they have a night, if they don't have night sweat, you will ask the parents, do they kick off their duvets when they wake up in the morning?
So how about 盗汗, night sweat?
Night
It's
sweat,
like
yeah, night sweat. Night sweat
and
is the typical one, but not necessarily every case shows the typical symptoms. So that's why I would say variation of questioning will help you to catch it more precisely.
so that's more qi deficiency or yin deficiency.
Yin deficiency.
Yin.
All the other symptoms I mentioned are all related to the yin deficiency.
Okay. So for night sweat, what's the best treatment or use your meridian?
You do anti-clock on kidney 6,
Kidney 6.
clockwise on kidney 2. So left foot, kidney 6, anti-clock.
Sorry, let me just write down. Kidney 6.
Kidney 6 on the left,
anti-clock.
yeah.
Kidney
And
2.
then kidney 2 on the right, clockwise.
So the kidney 6 is on both legs or just one?
Just one, left.
Left. So left kidney 6 anti-clock, right kidney 2 clockwise.
Clockwise.
Thank you very much.
Okay. Right, so these are the kidney qi, these are kidney patterns. So kidney qi deficiency, kidney qi stagnation, very rare. Kidney yin deficiency, kidney colon damp, yes. Kidney fire, usually rare, usually represented by the bladder fire. And kidney yang deficiency, and kidney blood also very rare. Okay, the function of the liver, the planner, or we call the commander. And liver stores the blood, menstruation. So anything to do with period cycle bleeding, liver need to be looked into, right? So because physical location was the blood, the liver stores a major, a reserve of the blood. And also kidney qi controls the opening and closing of the valve for blood into those period in the uterus. So therefore, menstruation itself is under the control of liver's regulation. So it stores the blood, one of thing, and also liver is the controller of the smooth flow of qi. So it actually helps with different smooth flow. One, emotions. Second, the digestions, stomach, spleen. And then third is the biles. And liver also dominates liver the tendons. So anything to do with ligaments, tendons, connective tissues, cartilages, it could be all related to the liver's illnesses. And then nails is part of the connective tissues and tendons. So liver will reflect on that. If there is a problem, the nails will start to become noticeably strange, different. And liver opens to the eyes. So therefore, anything related to those eyes or visions, you need to look into the liver. A liver houses hun, so subconsciousness and dreams. So if there's a liver's involvement, there's always dreams involvement too. Or the other way to say, if there's a dream disturbance, there's always a factor of liver's, roles in behind. Patterns and keywords for liver's diagnosis, I would say emotion and menstruation. Yeah, so anything, if you see a sign of like fluctuation of emotions or irregularity or problems with the menstruation, do look into liver. And these are the patterns for liver. So we have liver Qi deficiency, very rare, but that we do have. Okay, we can have on the clinic practice, especially with meridian palpation, you'll find quite a bit of that. And liver Qi stagnation, very common. Liver blood deficiency, common. Liver blood stagnation, yes, common. Liver yin deficiency, or sometimes with liver yang uprising, yes. Liver cold and damp, rare, but not nil. They still have some, especially with some channels and meridians. Liver fire, common too. Liver yang deficiency, very rare. And at last is the functional heart, the emperor, mind controller. So, and heart governs the blood and blood vessels. Therefore, circulation is the key word for that, and controls the blood vessels. And the body fluids from the heart is the sweat. So, anything related to sweat, you could look into the heart itself. Yeah, and heart open to the tongue, so it's related to speech as well. And also, heart is controlling the mind, your rationing. That can be controlling those movement of the speech and tongue. That are also under the control of the heart. Heart manifests in the complexion phase. So if that it's a pale face or red face, can be an indicator of heart conditions. Heart houses Hun, a Shen. So emotion related to joy and the mental state, laughing, overexcitement, that can be heart being affected. And heart also is a partner with small intestine, so the urine. And if there's heart fire or heat, then it can be reflected as a dark, scanty urine because of small intestine connections. Small intestine is a separation from the pure and the impure. So that's why it affects the urine too. And plus, because they're sharing the same name, Taiyang, with bladder, so it can passes its even the illnesses and toxins into the bladder itself, then affects the quality of the urine. And keywords for heart differentiation are these three: mind, spirit, and palpitation. Mind you can change into like mental or emotions. Yeah, mind, spirit, and palpitation. Anything symptom related to the heart will often have a complications of the palpitation, heart rate. And then these are all these patterns often you can see with the heart pathology. Tongue and pulse differentiation, I think we will skip it because we don't particularly look into that. And the meridian differentiation learning in the future, we will skip it that too. And I think we are running out of time. We only had about 15 minutes to come to the two hours. I think I will leave this one, the symptom differentiation, like frequent urine exterior, for you to think, right? How to work out this is if people present these symptoms, frequent urination, how can you work out whether this is exterior or interior? And then, as I said, 8 principles. You work out the first is to differentiate the exterior from the interior. Then differentiate interior, exterior to do with the cold and hot and in and all that, six evils. And then interior, you work out to do with different organs, kidneys, or livers, or others. And then qi, blood, yin, yang, to work out what you could be and what's the symptom that shows in here. And I could give you this you have your homework yourself to look into that, understand, and then we will go through this in the next before exams tutor time, and then we'll go through all that to help you to understand better. Okay, until this point, any more questions?
Don't worry, I'll go back and re-listen to that to digest. It's a lot.
I think it's a quite a fist today. It's too much information, I guess, for you to understand. But yeah, do come back to the lecture and listen more, and then go through the materials. I hope you understand better and you can learn more from that.
Can I ask a question, Dr. Ye? It was
Yes.
regarding the liver, and you were talking about menstruation and irregular menstruation. I have a patient like that, and then is constantly bleeding for 3 weeks nonstop. Because it's liver channel, I know you talk about meridian palpation, but would I be, because it's like there is irregularity, am I tonifying or am I reducing is in a case like this, if you think about it?
To talk about the bleeding itself, yeah. So you need to identify what actually could cause the problems. Right, there are two for me. One is to do with lacking the holding ability from the spleen. Second, it's overheated. Okay, and with overheated, you could have liver and kidney yin deficiency or liver fire. So three most common conditions. Sometimes they might be also related to the pericardium because pericardium has a branches into the uterus, which is also again related to the heat accumulating, yin deficient heat or fire from the pericardium. So for that, you will need to palpate pericardium, liver, kidney, and spleen, right? But with spleen qi deficiency, usually it's not painful. It will be necessary to find if the spleen is very hollow. Yeah. My way to do that, I will palpate on this, find out if there is really increased pain, particularly if it's related to kidney yin deficiency. Kidney 6, kidney 2, kidney 3 can be very painful, especially on the right side. If it's to do with liver fire, so liver 2 on both sides can be very painful. Yeah, if it's to do pericardium fire, pericardium 3 or pericardium 8 can be painful. So those one might indicate heat associated. If those ones are not very painful, then means there might be to do with the blood deficiency, qi deficiency, spleen qi deficiency. More precisely, I will do a test on those points. For example, if I do believe that it's a spleen qi deficiency, I will do anti-clock on liver 3 on the right, and liver spleen 3 on the right, and spleen 10 on the right. If they can help to cause a stronger contracting on the uterus, ask the lady trying to contract the uterus if she feel that it's a stronger grip, and that normally means if this spleen 3 and spleen 10 can create the strongest grip, then that indicates there's spleen deficiency. If not, then you will look at reducing on livers or 25 or reducing on kidneys or 25 reducing on this pericardium. Which one works better? Then I can give it ideas. Yeah, I had this case. Even like one lady like bleed for like 6 months. I do this method, and then within 2 days, it stopped. Yeah, this is the only way, because very often is when ladies bleeding for too long, and then even that is qi deficiency, that could be always a yin deficiency heat too, because they lost blood anyway and long term, and then turn into the yin deficiency. Then in the end, this complication will make very difficult to identify only by the points rating. Then the method of using this meridian palpation test on those effects of those on the body works much quicker.
Thank you.
Yeah, one of the interesting lady that as I mentioned out, the 6 months bleeding lady, and she's coming tomorrow. Now we move from those stopping of bleeding into other issue now, and The first time she came in, she was in a question. She wasn't, you know, she heard of me, but then doesn't know how much I can do that. And then she's already been through those process on consultation with the hospital doctors, all medications. And so I explained to her in this way, but then I told her, I say, the method is to trying to find out what cause it is, and I can do needles accordingly. And I said, if this is the right method, I will expect tonight after treatment, you will have a big squish, a lot of blood come out, but next day it will slow down. It happened exactly as I said, because obviously what happened is the bleeding in the Western idea is whether you have a fibroid or whether you have other issues, the bleeding is because the uterus loses the stronger grip, contraction is not strong enough. So the blood vessels are not pressed long enough or hard enough to be able to completely create the sealant on those broken bits. So you need to create a very strong contraction on the uterus to be able to get it. And then before to do that, a big, stronger contraction will squeeze all those old blood that already been let into the uterus, being squashed out. So it's all being squeezed out. So a big, heavy come out and then stop, slow down. So it happened exactly the next day. So a good sign. So then you just need to tell the patient, make them be aware that could be a big bleeding before it stops. So they will understand you and then they will follow you much, much more faithfully. Okay.
Thank you.
You're welcome. All right, so I think that's about today. And then I'm always here. So if you have further questions, do raise the questions and at me. So sometimes I don't have time to check all the time, but if you do at me, I will check in. Yeah. Right. Okay.
Sorry, Dr.
yeah,
regarding
yeah.
the exam, there are so many material we need to remember. So the exam style will be going to like a case study, or will be going to like a multiple choice, or
There will be multiple choice, and there will be short questions and the case study, 4 case studies.
So it's like give us a case. We need to do the treatment, how to do the treatment, or how
Yes,
to
yeah.
diagnose.
Well, there will be questions. Well, I will give you those mock papers so you know what exactly they look like.
Okay, thank you.
Okay.
Thank you very
Right.
much.
Thank you.
Thank you.
Bye.
Have a nice evening.
You too.
Bye. Bye.
Bye.